Welcome, everyone. Good afternoon and good morning if you're on the West Coast. Welcome to Iris Telehealth's virtual career fair. We're going to wait a couple of minutes after that for more participants to join. So while you wait, we have some quotes on the screen from our current providers, so you can take a look at them. And we'll begin in a few minutes. We're going to give it about 2 more minutes before we start. So again, welcome everyone. If you just joined, we just want to wait a few more minutes before we get this thing going. All right, we're going to go ahead and get started. So welcome everyone, as I stated. Um, Alex, can you go to the next slide, please? So welcome to our virtual career fair. Your presenters today will be myself, Aria Brown, and Dr. Tracy Malaire. And we have a few housekeeping items before we get started. The first being that this is recorded, and so you will be able to receive a copy of this after we present to you. And also, too, if you have any questions, there is a text box. You can type in those questions as we're going along, and we will have a Q&A question at the end. So first, I would like to introduce myself. My name is Bree Howard. I am the provider marketing manager here at Iris Telehealth, and my role is to get you all excited and want to come work for us at Iris. I do the recruitment marketing, and I also attend all of the clinical conferences. So if you're ever at any of like the APA, ACAP, or ACAs, please feel free to come by the booth and stop by and see us. And now I'm going to pass it off to Dr. Tracy Malaire to introduce herself.
Thanks, Bree. It's nice to see everyone. Thanks for joining. My name is Dr. Tracy Malaire. I am a child and adult psychiatrist. I am the medical director of scheduled services here at IRS, and my job is to stay in touch with our amazing providers and do whatever we can to lean in and make their lives easier to continue to do the work that they love and providing quality care. I've been practicing for about 15 years in various levels of care, and I've been with Iris for a little over 5 years now, and I've had a wonderful experience. I'm always happy to talk on and offline about what it's like the day to day of being a provider. At Iris, I started in a clinical position before pivoting to an administrative role, so I've really enjoyed getting to know Iris as a provider and on the admin side. So I'm really happy that you all have joined today. And I will pass it over to Arya.
Thank you, Dr. Miller. Hello, everyone. I'm Aria Brown. I'm the Senior Clinical Hiring Manager at IRIS, and I work really closely with both the clinics as well as our clinicians that go through our interview and vetting process. My goal is to take a look at the clinician's preferences, make sure that whatever I am presenting to them is in alignment, and also work very closely with the clinics to identify their need and the scope of work. And so I'm usually the second individual that you're connected with through the process, and I know we'll chat more about that a bit later on. But I'm grateful to be here today and to get to meet all of you. I've been at IRIS for coming up 2 years actually next month, so super excited there.
All right, so exactly what we're all here for, to learn more about Iris. So Iris was founded in 2013 by child and adolescent psychiatrist Dr. Tariq Shaheen, and Iris has grown substantially. It was first started in a small yellow house, and now we've become a 100% remote company. And we continue to be a physician-led medical group. Good medicine is at the heart of everything we do. We value our clinician experience as much as our patient experience. And so, working with Iris, you would not be working for a staffing company. We are very much different than a staffing company. What we do is we go across the country and we build relationships and partnerships with community mental health centers, hospitals, and health systems all around the country. And we place our clinicians 100% remotely in outpatient, inpatient, and EDCL. And currently, right now, we have over 400 service lines with partnerships in 39 states. And our average partnership length is 4.25 years. And so currently, our clinicians and providers are comprised of psychiatrists, PMHNPs, LCSWs, and newly added LPCs, and also LMFNTs. And we have over 420, and we are still constantly growing. And so we are 100% behavior health services. And for the foreseeable future, we'll stay 100% behavioral health services as well too. We currently select providers that share our mission and feel passionate about the work that we do. And we'll dig deeper into that little into the presentation about our core values and how we want our providers who join us to actually feel the same way. So a little bit more about our care models and services that we provide to our partners and our patients. The first is scheduled services, so our outpatient services. And you as a provider would get matched with a healthcare organization, and we'll meet all of your qualifications, your standards, and your experience. So for us, we want to match you with a site, with a partner of ours who you're passionate about. Maybe you're passionate about working with patients with ADHD or SPMI population. And what you'll do is you'll become a regular behavioral health provider for them. And you're going to treat patients on a dedicated schedule, and you'll have dedicated support from an IRIS team member as well as an on-site team member. You are fully engulfed into the site's healthcare system as well as their staff as well too. So you'll use all their software as well too. The next service line that we offer is Bridge Care Services, which is really new for us. And what it is that as we're doing our scheduled services, we noticed that there was a huge gap as far as the stabilization for our patients, transitioning from, crisis. So bridging that gap between emergency departments and acute inpatient care, and even an outpatient and back into the home. And what we noticed is that patients were constantly being thrown back into the cycle because after they were being provided their treatment, they would go home and, that was kind of it. And this bridge care service is to make sure that patients are not thrown back into the cycle and get that continued care that they need. And the last services that we do offer are on demand, and that's for our EDCL. And those are providers who are paired with a dedicated pod at a emergency department across the country. And it could be one emergency department, or it can be a span of multiple states and multiple health systems that you work with. And so you'll also have a dedicated member of IRIS as well too that assists you with maneuvering through either the ED system of one place or multiple. And now I'm going to pass it off to Aria Brown so she can get to let you know about our provider types and the hiring process here at IRIS.
Thank you, Bree. Yes, so as mentioned earlier, we do hire these particular provider types, including psychiatrists, both MD and DO, licensed clinical social workers, or licensed independent social workers. I know that the title can vary by state, as well as licensed marriage and family therapists and newly added LPCs, and then psychiatric mental health nurse practitioners. Next slide. Awesome. Now, when looking at each provider type, we do have some requirements below. Some are standard across the board. Some might be more discipline specific. For nurse practitioners, we do require the completion of a master's degree or a postgraduate degree program. Also, we want the nurse practitioner to be board certified and 2 years of post-board certification experience. When it comes to the clinical licensed therapist, at this current time, we only offer full-time 40 hours for those individuals. And so we are looking for therapists who are willing to work full-time 40 hours. Now, this can vary depending upon clinic hours. So there might be, of course, some flexibility within your day, depending on the hours of the clinic, but 40 hours is pretty standard. 2 years of experience as a clinical social worker or a clinical therapist. You must live in the US, and I could also say that that's the same across the board for all 3 of these. And then you must have passed the ASWB exam or NCE. Once again, I know that some of these are a little bit state specific, but those are the things that we look for when hiring our therapists. In addition, the MDs and DOs, we want to make sure that you have completed a 4-year accredited residency program in psychiatry, and then 1 active medical license. It's always a best practice for our MDs and DOs, as well as the other disciplines that we hire, to also have a license in the state in which they are residing in. Of course, the lovely beauty of telehealth is that you can provide services where the patients are, but we want to make sure that you also keep a active license in your home state as well, and then living in the US or US territory. Next slide. Awesome. So let's chat a bit about the candidate journey. I know that some of the bigger questions are, how long does it take to get through this process? And we truly have made it self-paced, but there are some markers that we want to make sure all of our candidates have the experience of doing. And so I'm going to do my best to summarize each of these for you. And then if there are any additional questions, we can certainly answer those towards the end in the Q&A section. But the very first step, of course, is to apply. We post on our actual website as well as sites like Indeed, LinkedIn, and so you'll have the chance to apply and submit your resume. Throughout that process, once you apply, we do have a team of individuals that are looking at your information to make sure that you at least meet the minimum requirements that we just referred to. Once you are beyond that initial screening stage, you will start the interview process. So there are three main steps in our interview. We have a phone screening with our clinical talent consultant. During the phone screening, that's where you're really going to get a lot of the initial information regarding IRIS, what it means to work here, our mission, really getting to know you as a clinician. And then after that, we do have a video portion. That's where we dive deeper into tech proficiency and really hone in on your preferences to make sure that this is a great fit for you in the organization. In addition to that, the third step of the interview process is meeting with our medical leadership, Dr. Miller being one of those individuals. And as she mentioned earlier, this is really to get to know you as a provider, to make sure that, you know, she can give you some insight on the day in the life, answer any questions that you may have. And it really solidifies our vetting process. So there are three main steps: the phone screen, the video interview, and then another interview with our medical leadership here. We also have a thorough vetting process when it comes to background. So we do have a background and attestation questionnaire that's sent over, as well as references. Typically for references, we require 4 at a minimum, one of which supervisor, and the rest can be peer references. In addition to the references in the background and attestation, there is a letter of intent that we send out. It's not a binding agreement, but the letter of intent is specifically stating that you agree to work with IRIS as we look to find an opportunity that suits your preferences that we've discussed. Once you've gone through the interview and the vetting process, that is where I will come into play. As a clinical hiring manager, it's my job to take a look at our applicants and see if there's anything that we have on our side when working with the clinics that would match preferences or may be something of interest to the individual that's applying. And so when we connect, it's usually regarding an opportunity. I am the one really giving you the information about the scope of work, making sure that it's something that aligns, and also giving you the next steps, which is what we call a meet and greet. So once you've completed our process and we've found an opportunity that could be a good fit for you, we want you to have the opportunity to meet with the clinic. Right? That's very important for us to know that the clinician and the clinic both align and it's a great fit for both parties. So typically meet and greets can be an hour. They can be with a number of clinic representatives, whether it be their staff, on-site psychiatrists, clinical support, directors, depends on the site. But of course, this is your opportunity as well as a clinician to ask any questions that you're curious about in making this decision. Once the meet and greet is finalized and both parties want to move forward, we do have an IRIS agreement as well as a service summary document, which is pretty much the scope of work for the opportunity that both parties agree upon. Once the contract is signed and the start date is solidified, we work with you during the implementation process to start your placement. Next slide. Awesome. So benefits and perks, right? What's in it for you? As far as benefits go, we do offer health, dental, and vision. Right now, we are with Blue Cross Blue Shield. In addition to that, life insurance and a 401k plan. So we do match 3.5% of the salary. And of course, there is PTO. So we offer up to 4 weeks of paid time off and 6 paid holidays per year. In addition to that, we provide equipment and support, right? So we want to make sure that you have what you need to perform the duties of this particular job. And in addition to that, you know, 24-hour technical support. We have all of our clinicians meet with IT prior to starting their assignment because we want to make sure, you know, the equipment is set up properly. If there's any questions, you know how to get a hold of our team. That's really a part of our support as you go into this particular opportunity with the clinic. In addition to providing the standard equipment, we also have a office expense stipend for $1,500. And so this can be used towards getting additional office equipment, right? So maybe you want a standing desk, maybe you want a specific chair, a specific monitor. You can use that stipend to get those particular things for yourself. Because of course, mentioning above, we do provide the standard laptop, mouse, headset, monitor for you to get started. We do provide continuing CMEs or CEUs, and there is a stipend for $1,500 towards that as well. It's something that we deem to be extremely important, and we wanted it to be a part of our perks and benefits here at IRIS. In addition, we have our malpractice insurance, which is a occurrence-based policy for all of our providers. Next slide, please. Now, when it comes to IRIS, you will hear us continuously speak about the amount of support that we have for our clinicians and those who are going through our process. And so one of those things is we do have a white glove support for licensing and credentialing related to your placement. So what this means is we have a credentialing team that will assist with licensures that might be needed. So for instance, let's say there's an opportunity that you're interested in, but it's in a state that you're not licensed in. We have a credentialing team that will support and apply for the licensure on your behalf. They'll also work very closely with the clinic's credentialing team to adhere to the start date and making sure they submit any important documents or applications that are needed for that process. So you will have someone that you're working with closely as a part of credentialing. IRIS also has what we call clinical onboarding managers, or COM for short. These individuals help with the clinical and administrative day-to-day functions. They're also huge advocates for the clinician. So if there is a situation where you feel you need some support, maybe there's some questions that you have, or just day-to-day things that could come about, they are your go-to. And it's really great that you know who this individual is. I know that they do have monthly check-ins as well. So, everything doesn't necessarily have to be about a specific issue that comes in hand, but, overall wellness, how are you doing? How are things going? And so they are really your support throughout your time at IRIS, and we make sure that you have that go-to individual. In addition to that, you will have access to our medical staff services team, who handle operations of licensing management for your duration at IRIS. And I know that has been extremely helpful. We want you to focus on what you're focusing on, and for licensing and or those licenses that are coming up and need renewal, our team monitors very closely. They understand when those things are happening, and they step in to make sure that your licenses are renewed and things are taken care of. So it's a part of our support here at IRIS that we offer. We definitely want to make sure that you don't feel like you're on an island just because you're doing tele. As Bree mentioned earlier, you are a part of an extension of the clinic. But in addition to that, a lot of individuals that we hire are technically IRIS employees that are working 30+ hours. So we want to make sure that you have that support from IRIS as well.
Okay, thanks, Aria. I know early on I touched on how we select providers who are passionate about and have the same mission and values as us. So I want to go over what IRIS core values are. And the first one is people over all else, which is definitely my favorite. So just valuing our relationships with our colleagues, other employees, the organizations and partnerships that we work with, acting with integrity and respect, doing the right thing. But also putting people over all else also means putting yourself forth, putting out your hand for a helping hand, because honestly, everything we do falls into the quality of care that we give to our patients. And for me and Aria, we're not actually, providers or clinicians who work with our patients, but everything we do is a trickle down effect. And we prosper or fail based on not having strength in our team. So we are only as strong as our weakest link. So people over all else is my favorite core value. The second one is suck less every day. And I know it sounds so harsh when you say it out loud. So we abbreviate it to SLED. And it's all about a journey towards excellence. So it's okay to make mistakes, but learn from them, grow from them, and improve in yourself and what you're doing continuously every single day, being dedicated to your craft and what you do. The next is execution is queen and king. So our ideas alone produce nothing. It's all about putting the hard work behind what you say. So we do what we say and we say what we do. And so we accomplish real results behind that. And then trusting and building in our relationships with ourselves and our colleagues to actually execute what we do every single day. The next is be quick, but don't hurry. And a lot of our partners love this about us. This was probably their favorite core value. So we want to move as fast as possible, but we don't want to move to the point where we're messing up the quality of care and sacrificing the quality of care that we're giving to our patients. So it's all about striking a balance between your quality of work and moving as quick as possible. And the last one is live your work, love your work. As I stated before, at Iris, we want to work with and select providers who are also passionate about helping our patients, doing our best, and even the smallest tasks that we do every single day. You know, what we do is a reflection of ourselves, and we put our heart and souls into our work every single day so we can see our results and we can be truly proud of our results. So those are our core values here at Iris. So next we're going to have a Q&A section with Dr. Tracy Malaire, and Ari and I can step in for any questions as well too if it involves regarding like the candidate journey. So please, if you have any questions, feel free now to type those in to the text box so we can answer them.
Thanks, Bree. And I know while we're waiting for the questions to come in, as a provider, as I sit and listen to the slides, particularly about the onboarding process, I was just remembering when I went through this and was applying for Iris and trying to learn about Iris and then understand how that fits in with the clinical position. I must say that clinical hiring, our medical staff services were excellent in helping me along the way. I just don't even know how our folks are so organized, making it really easy with, I mean, all the credentialing. I know as providers, we know is just so much work. And the fact that they coordinate that for you is just exceptional. And I just wanted to give a shout out to that process. And when you're onboarding, they just help it be seamless because I know that can be very overwhelming thinking about that. One of the questions that came in, who else is part of our medical leadership team? And our leadership team has grown as Iris has grown. Again, a credit to Iris that they want to have clinician leaders, you know, staying true to, you know, we're a physician founded and led company. Our CMO is Dr. Tom Milam, who was the medical director when I was interviewing, and Iris has grown, and he's our CMO and is amazing. I am the medical director of our scheduled service arm, so those typical clinics, daytime kind of hours, kind of settings. I'm talking with our providers and working with that arm. And then we have clinical leaders for each discipline. We have a clinician leader of social workers, Don Napier, who's amazing. And then we have a nurse practitioner lead, LaDonna, who is also equally amazing. And our jobs is really to stay in touch with providers. We're available really 24/7 if needs come up. We are here full time. We also work on, as our Joint Commission accreditation requires, we do chart reviews, peer reviews, really acknowledging the excellent work our providers are doing, and love to be available and check in with providers for whatever comes up. That's not to say there is fabulous leadership within each clinical setting, and that looks different depending on what type of setting it is and how big the setting is. But we work in parallel with the clinical leadership within your specific clinical setting. Okay, the next question that came in, I'm not sure if who wants to do this one. It's regarding more details about the compensation structure.
Yeah, sure. And I do believe there was a follow-up, W-2 versus 1099 independent contracting. And so we do provide both. So anything above 30 hours at Iris would be considered W-2 salary positions. Anything below 30 would be considered 1099. However, we do have some individuals that work full-time hours, meaning 30 plus hours, who still opt to be independent contractors. And so that is certainly an option that you have. No matter if you're working 30 to 40 hours, you can be salaried or you can be an independent contractor or 1099. It's just that anything under 30 hours would technically not qualify for benefits. And so most of our opportunities are at least 24 to 40 hours. Randomly, we might have options that are 2 days a week, but I know that our standard opportunities are typically at least 24 hours in terms of like hours that you would be assigned for a specific clinic.
There is a question about, is Iris currently hiring for psychiatric mental health nurse practitioner positions?
Yeah, so we actually are hiring for specific states. I know right now Connecticut is a state in which we are looking. We've also had some opportunities in states like Texas as well. And so typically when you're applying as a nurse practitioner, our team will let you know if there's anything available in the state in which you're licensed in. If there's no option available, the beauty of Iris is, you know, we're a medical group, so you can always go through our process and we will follow up with you when we do have options available in the state in which you're licensed in. There might be an option for you to also get a license in another state, depending upon timing of the clinic and when they're looking for someone to start. But certainly those things would be discussed as part of our interview process.
Great, thanks, Aria. We had a question, what online medical record is used, or does it vary depending on placement? And you're absolutely correct. We don't have an Iris electronic health record per se. We use whatever electronic health record is used within the partner or clinic. So really, you know, you are completely embedded in the team, you know, as if you were there on the ground. The expectation is you're a full member, you're not siloed, so you have full access to the electronic health record, and we make sure, you know, you have passwords and you're able to get into it before you start. There's time to train on the EHR. There's not an expectation that you have experience, because even if you have experience in a particular EHR, it can look different within a different organization. So there's time allowed for that. One question I generally ask folks when they're interviewing is if there are, you know, EHRs that are like a no-go for them, because I know some providers have had particular experiences with a specific electronic health record, but it's information that you would have upfront. I know it's a really important factor in considering a specific clinical position because it affects the workflow and the day-to-day. And then the next question, how long do adult and child psychiatrists have for new evals and follow-ups? Really great question. And I'll back up a little and talk about, we really research our potential partners at length in detail and really establish a relationship with them before we consider partnering and placing anyone there. They have to be some place where we all want to work. We have standards that they need to meet. And we hold clinics accountable to the scope of work so that there are no surprises insofar as possible when someone starts. And one of those things that we absolutely need to know about are appointment times. I can say the standard for adults, generally 60-minute intakes, 30-minute follow-ups. We don't partner with those entities that have 50-minute med checks. Granted, sometimes our patients are stable enough, usually that's not, and we want to make sure our providers have time built in the workday for e-prescribing and documentation and collaterals and all those things that come along with a patient appointment. The intakes generally are 60 minutes for adults and then 30-minute follow-ups for adults. Rare exception, 20-minute follow-ups. It really depends. They have to have quite a high no-show rate. But again, this information would be discussed with you at outset for discussing a clinical position. And then there is some variation for child. As a child psychiatrist, I know how much work goes in that collateral information, contacts, speaking with the family. Our minimum is 60. Some partners will give longer. I know we generally want longer as child psychiatrists. Our community mental health centers generally will give 60. Sometimes there's opportunity to bring back complex patients for another new patient appointment. And then there are some other clinics that will give 90 minutes plus. There's a lot of variability in that child piece. I can say all our child follow-ups are always 30 minutes. It's never less, because we again know that there is a higher complexity in terms of that collateral with the family and need to make sure that's allowed for. And again, it's something we ask with our initial contacts about preferences for appointment times as well, because we know that needs to align with the clinical position for providers to feel comfortable and to feel like they're delivering the care the best that they can. So that's a really important factor that we ask our clinicians and get that information from our partners as well. Let's see. Oh, this is a great question. Are patients that you work with at the clinic already established, or do you have to build up your own clientele? Such a great question, because it really affects what your life is like onboarding at a clinic, and it really depends, which I know is a frustrating answer. What I can say is that there always is an onboarding time, a ramp up time for training. You're not sort of thrown in and have like day one a full panel of patients. Again, we'll have that information when we're discussing about a clinical opportunity, and it's something our providers, I know, really ask details about during a meet and greet with a potential partner, is how they will be ramped up and how much time is allowed for transfer patients if they're coming from another provider, or is this a new service line and completely all of the patients will be new, because we know that can be taxing too, right? Having just all new intakes, and we really pay attention to the pacing of it. So that really varies within a specific clinical setting in terms of, the patients that you'll be taking. If you're taking over for a provider that was previously there with an established panel, will this be a completely new service line or a combination thereof? So that's a great question with some variability there. So let's see. Is it like a locum tenens job where Iris serves as an agent to connect the provider with the hospital? I'm so glad someone asked this question. So we're not a locums company. We don't consider ourselves a locums company. We're really clear with our partners, and they come to us wanting a long-term relationship, a long-term provider with the same level of permanency, like if you were applying, to an in-person job on the ground. So there's not like a 3-month kind of stint. They're looking for providers that want to settle in and establish those relationships with their patients and staff. I know how hard it is to learn any new workflow, particularly remotely. It can take a little bit more effort to get to know everyone you work with, the communication workflows, and then, of course, establishing the relationship with patients. So our providers really consider Iris a medical group, not a placement or locums company. They really consider an Iris employee as a full employee there, all the expectations and involvement as any other member of the team, so that our providers shouldn't feel siloed in any way. You should feel that connection with the clinic and a permanency to your employment. I hope that answers the question in terms of connecting a provider with the clinic, because even though we establish that match. We're clear with the partner that our relationship with them continues throughout your employment with Iris. We check in with the partner, make sure things are going well, make sure the service line is continuing as expected. And as said earlier, as a provider, you have touch points with Iris. We are running in parallel with your clinical setting and are here for you full time, whether that be an IT concern, a clinical concern. We are involved as much as you need us. We have grand rounds, we have case conferences, we have a SharePoint water cooler chat that people can, get to know other Iris providers. So lots of opportunities to connect with us when and if you want to, in addition to your clinical setting. So we're really along for the duration of the time. And I think our clinical operation managers are a great example of people that are a go-to for our providers. My calm when I started at Iris was so very helpful in just answering any questions, helping me make sure my computer was working, like any question at all. They're available, and I can't say enough about how supportive they are. And they'll be your person as long as you stay employed with Iris. So we're here to stick it out with you all for the long term. Okay, let's see. I don't know if you want to go in order. I know the questions keep coming in. I want to get to as many as possible. Are there intake-only positions for licensed clinicians, or is the primary job role for clinicians to provide individual therapy? I can answer that from a clinical perspective. I know you all have perspective from clin hiring as well, but I do know there are roles for both depending on the setting. We do have clinicians doing just intakes. I think the majority of our clinicians right now are doing therapy. We do have standards for those appointment times to 60 minutes for therapy. And so there's the opportunity to do both.
Yep, you answered that great, Dr. Malaire. I know in our bridge care services, we see a lot more intake positions too. So bridge care has both though, intake and therapy, but we've seen more intake side on the bridge care side.
Really great point. Thanks, Bree. Ken, what are the opportunities for advancement? Would it be through the site or Iris? Another great question. I think there are lots of opportunity for advancement for folks that are interested. I am proof positive of that. I started interviewing at Iris in a clinical position, had a great experience, and transitioned to more of a clinical role. And I know Iris promotes from within and wants to support folks' professional growth. That's one of the things when the clinical operations managers are checking in with the providers, just seeing what they're doing, how they're feeling about where they are, if they're happy, if there's something on their mind. I know at Iris, as we're growing, we need help administratively. There are different opportunities that arise, so that we ask folks, if they're interested. It's great for us to know. Different initiatives like our quality committee, for example, where we need clinician input, have been recent opportunities that we've had for clinicians that, want to get involved more administratively. Some of our clinicians are physicians want to do nurse practitioner supervision. There's opportunities there, or education. Some of our clinicians really love to teach. So we love to be aware of that because that will come up in different clinical opportunities. And then within the sites as well, we have specific opportunities for, medical director roles perhaps, and different opportunities for teaching, as I was saying, within the clinical setting, and there's variability there. So there's definitely options for professional growth within Iris and within clinical opportunities. And it's great to mention, as you're applying, if you have interest or if you develop that over time, it's a great thing to mention when we're doing check-ins, because I know that's something that folks have added on along their tenure with us. let's see, is there certain ICSW or clinical billing hours required per week? That's a great question. And I can say, um, I'll back it up a little in terms of our general model is that are, you have a scope of work for hours worked. And we know inevitably there'll be a no-show, there'll be a cancellation, but you are paid for the time worked. And I know for LICSWs that each um, appointment is for 60 minutes. And so there's not a specific billing requirement per week, like for people to be paid, for example. I just know that the expectation is for the hours worked, and the clinics will fill up anyone's schedule in so much or as it is possible. And they do that in different ways in terms of how they handle cancellations or no shows, or if volume is low, how they try to strategize, because, we need to make sure that enough patients are being seen, that we're serving the community needed. And it's something when we're scoping that we look at to just make sure there is sufficient volume so that there is a long-term possibility for the service line, and there isn't any challenges. I don't know if anyone else has anything else to add to that piece.
No.
I think you covered it. I know in the beginning I talked a little bit about LCSWs working 40 hours a week, and that could be standard. So if we're looking at let's say Monday through Friday, 8 to 5 p.m., you're typically working from 8 to 5 with a non-paid hour lunch. And so technically you would be billing for that 40 hours a week of work based upon those standards. But to Dr. Miller's point, I know that in terms of the specifics for the clinic, there's always a ramp up, and it could certainly depend what those billable hours look like for you.
Thanks, Aria. That's great. Question about the youngest age for children. Great question. And definitely something we ask about our preferred ages. We know that, we respect that. Some of our providers want to work the lifespan, some just with kids, some just with adults. And we want to match that with the clinical setting, and know what the lower age or lower range of age is in a clinical setting. So that's something when we're talking with the partners, we know that. We'll have the diagnosis breakdown, age breakdown, the expectations of the ages that the provider will see, because we want everyone practicing with the age range that they feel is their comfort level and area of expertise. So we don't have like a lower end of a cutoff for an age for a kiddo to be seen, but that being said, it's cleared in your scope of work so that there wouldn't be no surprises. Sometimes an adult provider will want to work with some teenagers, or or a child provider will want to work with some transitional age young adults. So we really check in and hone on what preferences are so that it aligns and that there are no surprises, because we know working with very young children requires a different skill set than working with geriatrics, and we want to make sure there are no surprises there. Are physicians responsible for their own scheduling or billing? Great question. Generally, I can say the model within each clinic, there are clinic support, so there are staffs, there are assistants, there's nursing, generally depending on what type of clinic or level of care, so that you're not expected to do your own scheduling. Generally, there'll be a couple intakes a day and then follow-ups, so that you are not required to handle that piece. I know our clinics want providers focusing on the patient care and seeing the patients. Some of the different LICSW models will have some more flexibility so that they are scheduling some of their follow-ups, and it really is site dependent. So that is something, information that we would have for you. But for our prescribers, I can say that there are not expectations to schedule for the patients. And then in terms of billing, as we say, we use the electronic health record within the clinical setting. So generally at the end of an appointment, our clinician with the note is dropping the charges for billing. And that is completely, you are completely trained on that before you're expected to start within a clinical setting. A typical day as a psychiatrist in a clinical role, absolutely. I think it's such a great question. And something on a meet and greet within a setting. I know our clinicians ask, like, what is a day in a life like working there? Because there's so much variety and it depends on level of care. I can say with an outpatient setting, I mean, a day in a life really mirrors, excuse me, as if you're on the ground. And that's, I think, the beauty of Iris, that you're so integrated into the team that you have, you have a connection, you know who your medical staff are, you know who's doing the scheduling for the day, you know what the crisis workflow is or who to contact if there are any concerns at all. And so generally, you're coming in, if you want to preview charts, you're seeing your intakes in the morning, generally, maybe follow-ups, there's, time for admin work, there's time for, lunch. But the beauty of it is that the day in the life, there really should be no surprises by the time you start because of all the work that's gone into really scoping the clinical hiring opportunity, getting that information to you and having your questions answered. So that I found to be very true when I started, that there weren't surprises. I really knew what to expect. The training with Iris in the clinical setting happens and is excellent. So it's really, a day in a life in a setting which really mirrors being on the ground. Variety, of course, within the clinical setting, if they have staff meetings or if you're doing some type of nurse practitioner supervision, there's separate admin time allotted for that too. It's not an add-on. Or if you're doing a medical director role, that is a separate allotted time too. It's not an add-on. So there's really great structure to your day. I hope that answers the question. I'm, again, always happy to answer specifics offline as well.
Mm-hmm. Yes, thank you, Dr. Malaire and Aria, for answering those questions. I know we're coming up on our time, so before we end, I will provide an email address if you do have any additional questions. And before we end, if you would like to sign up for our Behavioral Health Messenger, this just keeps you up to date on everything Iris, as well as mindfulness tips, behavioral health industry news, the job opportunities that we have currently at Iris as well too. So go ahead, pull out your phone, scan that QR code, and learn more about Iris and everything that we have going on in the industry. Next slide. So if after this virtual career fair, you are excited to work with Iris potentially in the future, you can go ahead and email your resume to talent@iristelehealth.com. You can also email any additional questions to that email as well too. We ask that you just put career fair interest in the subject line, since we're have so many emails and people applying, but we want to know specifically if you attended the career fair, and just go ahead and attach your CV to that email. And again, thank you so much for attending our virtual career fair today. Again, if you have any additional questions or would like to learn more, you can email us at talent@iristelehealth.com, or you can visit our website at iristelehealth.com. And I hope you have a great ending to your week and a great weekend. Thank you for attending, everyone. Bye.
Thanks, everyone.
Thanks, everybody.